While the attendees are trickling in, I just want to say good morning to everyone. I think we are going to go ahead and get started. I'll begin with some opening remarks, and I just want to let folks know that unfortunately one of our panelists is having some video technical difficulties. He got all dressed up for us, got ready to go, but there's an issue with his camera, but we are going to carry on with him despite the fact that we can't see him, but he will be one of our panelists. So I want to thank everyone for taking the time this morning for this really important session for the veterans in our community. And for those of you who either represent a veteran or are a spouse to a veteran, a child to a veteran, or a veteran yourself, if you could please help us spread this information, spread the word, that would be incredibly helpful to us. I want to introduce our incredible panel, who I think all of you are probably very familiar with. Online with us this morning is Ms. Blanca Aragon. She's the nurse executive of the El Paso VA. We also have Dr. Eric Glass, a physician with the El Paso VA. Colonel Michael Oshiki, he's the commander of William Beaumont Army Medical Center. And as I mentioned, Mr. Joe Esparza, who you can't see on camera, but he's with us, and he is with the Veterans Benefits Administration. I want to begin by providing some really important data from the Texas Health and Human Services, which is showing positive vaccination progress in El Paso County. You know, yesterday, DHS Secretary Alejandro Mayorkas accepted my invitation to come to El Paso, and as part of our conversation, I asked him for even more vaccines for El Paso through FEMA because we are showing such positive progress. We have created an efficient system in the community, but also the folks on the VA side have created such an efficient process. And so I'm grateful to everyone for the success that we've seen so far. As of this morning, nearly 500,000 doses of the COVID vaccine have been administered, and 173,000 El Pasoans are now fully, completely vaccinated, which is huge. That is the direction we want to move in so that we can reach herd immunity, so that we can have events like these in person at some point instead of virtually, and so that our lives and our economy can achieve some normalcy. Even though we can see the light at the end of the tunnel, I do want to remind everyone that we've got to continue to observe CDC guidelines, even those who have been fortunate enough to have been vaccinated. It's important that we continue to wear our masks and we take care of one another so that we don't contribute to the spread. There's still so much we don't know about the coronavirus, so better safe than sorry. Now, in order to ensure that vaccines reach every community as quickly as possible, as you all know, we passed the American Rescue Plan several weeks ago. And the bill included $7.5 billion in CDC funding for vaccine distribution. The funding will ensure that communities like ours are going to continue to receive the vaccine as quickly as possible. The bill also allocated $14.5 billion for COVID-19 related healthcare for veterans, including information technology and facility requirements, expanded mental health care, and enhancing telehealth capabilities in order to ensure access for the 9.2 million enrolled veterans. The bill also provides resources for our veterans currently receiving housing support, including an estimated 37,000 homeless veterans nationwide. The American Rescue Plan also provided $1 billion for debt forgiveness related to co-payments and other cost sharing that veterans paid for VA healthcare, and to reimburse veterans who paid a copay or other cost sharing for care and prescriptions provided from April 6th of last year through September 30th of this year. It also provided $750 million to state homes to greatly improve the living conditions of our most vulnerable veterans, to support their COVID-19 response, and to promote staff and veteran safety at those facilities. It also provided $386 million to initiate a COVID-19 Veteran Rapid Retraining Assistance Program. And that program provides up to 12 months of training and employment assistance for unemployed veterans so that they can enter high demand and well-paying jobs. It also provides $262 million to reduce the backlog of total compensation and pension claims, which has grown to more than 212,000 claims nationwide as of March 2021. This funding will enable our Veterans Benefits Administration to reduce those claims in that backlog to around 100,000 by September of next year. We are going to continue to focus on the backlog so that we reduce it and make sure that we make veterans whole. It also includes $80 million to establish the Department of Veterans Affairs Employee Leave Fund, which provides funds for paid leave for COVID-19 related causes. And $10 million to decrease the Board of Veterans Appeals hearing requests, which are currently at over 87,000, and intake backlogs currently at 35,000 appeals. These efforts help veterans economically by resolving their VA appeals and, if granted, allowing them to begin receiving compensation and services. There are other great aspects to the American Rescue Plan, far too many to list, but I do want to highlight something because many of our veterans are key players in our local economy through small businesses, especially through restaurants. So in our bill, the American Rescue Plan prioritizes veterans for the $28.5 billion restaurant revitalization grants in the Small Business Administration's Restaurant Revitalization Fund. So we want to get these restaurants, these veteran-owned restaurants, back on their feet. We want to go enjoy your food at your restaurant. And so please, if you need any help accessing any of these funds, reach out to us. But that's part of why we are gathered here together. We want to make sure that you get access to information that you need. I want to thank all of our panelists. I want to thank Carlos Murillo from my office who brought us all together and organized us. He's doing a fantastic job. He is your connection in my district office to so much of this information. Thank you all again for joining, and I look forward to making sure that you get all of the answers that you need. And again, my incredible gratitude to our panelists. Thank you so much. Carlos, I'll turn it back over to you.
Thank you, Congresswoman. And we'll go ahead and move over to Nurse Executive Blanca Aragon to provide an update, pardon me, from our local VA.
Hi, good morning. So thank you again for giving us the opportunity to provide information to our veterans and their family. We're really excited. As a nurse executive, I'm very excited. Congresswoman Escobar had mentioned all of the great work that not only the VA, but the city is doing in vaccinating our community. And so that's so important to reach that herd immunity that we keep talking about and CDC keeps talking about. So we are excited to be part of the community and partners in the community to make sure we're doing all that we can for our citizens here in El Paso. So just a few updates. We started out with the older population for the veterans to get them vaccinated. And so now we have opened it up to all age groups. So all enrolled veterans can call and get an appointment. We do have availability and we do have vaccine. And we're extending clinics. We're doing things in the evening and on Saturdays. Our staff is working really hard to get additional vaccine out there. And then something super exciting is the new Save Lives Act law that went into effect. And so what that does is it expands our ability to and our authority to provide vaccines to additional groups. So not only can we do enrolled veterans, but veterans who are not enrolled, veterans who otherwise would not qualify for healthcare through the VA. Now they're eligible to get through the vaccine through the VA. And then of course, spouses and caregivers as well. So with that new legislation, we are encouraging those newly eligible to visit the website online. I can put the link in the chat, but if you go to www.va.gov, Right at the top of the page, there is a link about COVID vaccine information. And there is a very simple tool for you to register online, but it does two things for us. One, if you're a spouse of a veteran or a newly eligible veteran, it gives us the information that you want the vaccine through the VA. So we know to reach out to you or for you to call. But more importantly, it gives us all of the information that we need to create a record so that we can document the vaccine once we do give it to you. So if you go online and you register, give it about 24 hours, and then please call here to the main facility, and then we can schedule an appointment for you. You can call here at 915-564-6100. Again, 915-564-6100. You're going to hit option 2, and that'll get you into our call center through primary care to be able to schedule that appointment, and we can take care of you as soon as we can. Another exciting thing, next week, we're going to have a couple of walk-in events. So if you know veterans or veteran spouses or caregivers that have enrolled or registered through the online tool, please invite them to attend our walk-in events. The first event will take place on the 14th, which is Wednesday in the evening from 4 to 6. And we are going to take walk-ins for women veterans. So female veterans, it is targeted for them to come in, no appointment needed, between 4 and 6 p.m. here at the main facility on North Piedras. That's on the 14th. Then on the 15th, tax day, we're doing, don't file your taxes jointly, come get your vaxes jointly with us. So we're inviting veterans and their spouses to come in as on a walk-in basis, again, between 4 and 6 p.m. here at the main facility on April the 15th to receive their COVID-19 vaccine. Again, if spouses are interested, please register before that event so we have all of the information in the system and your record can be created. Again, I'll put the link there in the chat box so you all can go and spread the information. And if you have any questions about COVID-19 vaccine, please again give us a call here at our call center at our main number, 915-564-6100, and then hit option 2. And those are all the updates that I have. And if you have questions, just let me know. I'm sure we'll have a Q&A session later or something. Thank you.
And speaking of COVID-19 vaccine questions, I want to turn it over to Dr. Eric Glass, a physician with the El Paso VA, to just speak about the safety and the efficacy of these vaccines. Hopefully dispel some rumors as well.
Good morning. Folks, I'm Dr. Eric Glass. I'm a retired Navy physician and married to another Dr. Glass, Christine. She's my wife. She's a psychiatrist here at the VA, also Navy vet. And for the last 5 years, we've both been here serving our fellow veterans in El Paso. And this last year, we've both been pretty busy with a lot of our COVID cases. This past year, I've worked closely with Blanca Aragon, our nurse executive, in helping set up some of our vaccine clinics. The first vaccine effort we did was vaccine our fellow employees, since they're healthcare workers and exposed to COVID. I've personally seen dramatic improvement in the health of our fellow employees here, since I'm the employee health doctor. We vaccinated around 1,000, a little more than 1,000 employees. Before we had the vaccine, we had 155 of our staff get COVID, and 3 of our staff died this year from COVID. Fellow medical professionals working here, serving our veterans. So I've seen firsthand the cost of COVID. It's been striking and certainly a little bit scary. In the past month, we've gone from having 15, 20 cases a month down to 1. We've had 1 person this past month that got the vaccine series that's gotten COVID. And thankfully, like all people that got the vaccine, the individual did not have any serious complications. They weren't hospitalized. They didn't die. So I know the vaccine works. I know it by talking to my fellow employees. I know it myself. I was one of the first people that got the vaccine here. The vaccines that we have here at our facility are the Moderna and the Johnson & Johnson vaccine. They're a little bit different, but they're both very effective. I know that some institutions in town, including our colleagues over at Beaumont, they have the Pfizer vaccine, which is similar to the Moderna. It's a 2-shot series. Both vaccines are very safe. I've treated thousands of people and given several hundred doses myself. I've had 0 people die from a vaccine reaction. I've had a few reactions from the vaccine. As a matter of fact, I had 2 of my staff get an anaphylactic reaction. That's when people have hives or difficulty breathing. Both those people got EpiPens. They both went to the local emergency room at Beaumont. They got very good care. And the interesting thing about both of those employees, they both came back and talked to me. And they said to me, Doc, I've had anaphylaxis before. I know it's unlikely, but I would have gotten the shot again. They both told me that. They said, I'm more afraid of COVID than I am anaphylaxis. And I agree. I'm a big wimp. I hate shots. Ask my wife. They have to trick me every time we get a flu shot. You're in our facility. They tell me they're having an ice cream party, and I show up and I'm getting a shot instead. So I'm not a big fan of shots. But I get the flu shot every year. I got the COVID shot this year. The flu shot on a good year, it's about 60 to 70% effective. Now, the COVID vaccines that we have, especially Moderna and the Pfizer, they're 94 to 95% effective. So it's much more effective than flu. And from a safety standpoint, I think that the safety profile for a COVID vaccine is very comparable to the usual flu vaccines or other vaccines that we get on a regular basis. So I think that the COVID vaccine is safe. I think that it's very effective. I've seen that in my own staff, and the national data certainly parses that as well. It's very similar. There are variants out there. There are new mutations like the B117 from the UK, like the B1351 from South Africa. There are other variants out there that are making people sick, that are worse than the COVID we saw last year. So one of the reasons I encourage my fellow employees, and I encourage our veterans to get vaccinated as soon as possible, is the faster we vaccinate people, the less COVID infections we'll have in the community and the less chance for mutation. So the sooner we get the vaccine into the arms of people, the sooner we'll reach herd immunity, and we don't have to worry about these mutations that are evolving throughout the world. So I do encourage people, get vaccinated. Right? I've been vaccinated, my spouse has been vaccinated, and I did it to protect myself, obviously, but to protect my patients. I have 2 young kids at home, both with asthma. I've got a mother-in-law, out in town with cancer. So it's not just me, right, when it comes to, what's the reason to take the vaccine. I think of the other people around me, the vulnerable people in my own family that, if they got COVID, it would be a big deal for them. So I encourage people, find your why when it comes to the vaccine. If you have questions, please feel free to reach out to your primary care providers, to the staff here at the VA. We're always happy to talk about vaccines. I try to dispel myths. Some veterans have told me that they're worried that the mRNA vaccine is going to change their DNA. It's not the case. It doesn't go into your cells and change your DNA. What it does, it produces the spike protein that the virus uses to attack our bodies. And so when your body sees that new protein, it develops these antibodies to help keep us safe. So it's not going to change your DNA. It's not going to make you grow a tail. I don't have a tail. I can stand up and show you. I'm still the same caveman I've always been. So I've got the vaccine, and I definitely recommend it, even though I don't like vaccines, because I'm a big wimp and I don't like needles. But I think it's a safe, effective means to keep our population safe, keep our friends, our family safe. And I think it's the best tool we have right now. I do encourage people, keep wearing masks. I still wear my mask every day, right? I try to keep other people safe. There is a small chance that I could get COVID again, especially with the new variants out. So I still wash my hands, I still wear my mask, and I still make good choices when it comes to hygiene. But that's all I've got this morning, unless you have any questions.
Thank you, Dr. Glass. And we'll have to take questions here at the end as well. We have a few coming in and a lot of pre-submitted ones. But we'll go ahead and pass it over to Commander William Beaumont Army Medical Center, Colonel Michael Oshiki, for an update as well.
Hi, thanks so much. And I just want to take a moment to thank Representative Escobar and her staff, as well as Mr. Amaral, Ms. Aragon, and our partners at the Veterans Administration for all that you guys are doing to assist in taking care of veterans and all of our beneficiaries here in the El Paso area. I'm very excited here at William Beaumont. We've received some additional shipments of the COVID vaccine, and we're excited that we are resuming vaccinations for all eligible beneficiaries age 16 and above. And that's we had to pause the vaccination campaign earlier last month because we were a victim of our own success. There were so many folks that wanted the vaccine, and like many places in the country, we encountered a period of time where the demand exceeded our supply. The good news is that we are now on track to resume vaccinations. We don't anticipate any further disruptions in the supply chain, and we're excited to resume our vaccinations. We are working hand in hand with our partners at the VA. As Dr. Glass said, we're using the Pfizer vaccine. We are vaccinating some beneficiaries who come to Fort Bliss, who received the first dose of the Moderna vaccine at another location. And we do have a limited supply of the Moderna second dose vaccine. So we're excited to resume the program and to work on with our partners to make sure that all of our beneficiaries here in the greater El Paso area have the opportunity to get the vaccine. And like Dr. Glass said, I'm a family physician. I've gotten my vaccine. I think this is absolutely our pathway to getting to where we all want to be again. So thanks for the opportunity to be here today.
Absolutely. And thank you, sir. I know you have to jump off right now, so no worries. And I'll go ahead and pass it over to Mr. Joe Esparza with the Veterans Benefits Administration to provide an update as well. Again, his video is not working. He did get dressed up for us, but I'll pass that mic over to you, sir.
All right. Good morning, everyone. I appreciate the Congresswoman inviting us to this session, and obviously all my colleagues from the VA being on, and obviously the Colonel over at William Beaumont. We're all one big team, and we all try to help each other. And it's great to see how they're doing everything with the community and our veterans to try to get everybody vaccinated, dealing with the pandemic. As far as on the VBA side of the house, or the Veterans Benefits Administration, we still are currently teleworking in the local area. As you all recall, El Paso was one of the hardest hit areas when the pandemic took its wave a few months back here locally. And we were on the national news and everything. And so they're being very cautious with the VBA side of the house, specifically our office here locally. They do not want to bring us into the office and cause problems to where one of our employees would be infected, or vice versa, we would infect a veteran. So they want to make sure everybody gets the vaccine, and VHA has been working with us for that. I've slotted most of my employees with them, so we appreciate all the support they've given us on that. But moving forward, eventually, hopefully we will open the local office and continue to work the way we did in the past, at least to somewhat of a normalcy. Obviously, everybody's seen the plexiglass and the masking and all that stuff, and we'll continue to follow the same format. And we work in the VHA facility, so obviously we'll adhere to the guidelines that the director puts out there as well. We are processing mail, we are doing claims, we are doing ratings, we are doing a lot of telephonic and virtual interviews as well. So a lot of this is being handled that way. I know that people are always interested, and I went ahead and put that in the chat, how they can reach out to us. I listed the 1-800 number so they could contact us, and that's the 1-800-827-1000 number. And of course, you can go online and go to va.gov, and you can go on that site and you can file a claim, request copies, do award letters. That site is very user-friendly. It'll walk you through the steps. So if you've been previously denied on a claim, for example, and you're wanting to file a claim now on a previous denied claim, if you click on the specific spots on that site, it'll walk you through. Have you ever filed a claim? Yes or no? And you'd mark yes or no. In this case, you would say yes. Was it previously denied? Yes or no? And then you would say, if it was previously denied, yes, then it'll take you to what specific form you would use in that instance. And then, of course, you have the option of uploading the form once you've completed it electronically, or you can print it, and it'll actually tell you where you can send the form by mail if you choose to do it that way. So those are the avenues right now we're using until we open up the main office here locally. I did want to pass a recent update, which we've done on the town halls with VHA, but again, on the community, we want to make sure they understand that e-benefits is going away as of this month. By the end of April, e-benefits will no longer be something that we utilize. Everything we're going to be switching over completely to va.gov. So again, make sure that everyone is aware that this is happening, and the place to go now would be va.gov if you work online or you want to utilize the online services with the VA. So that's something of importance. Loan guarantee, effective April 5th, which was about 3-4 days ago, they're no longer accepting faxes. And at one time, a lot of individuals would come into an office or go deal with a realtor or a bank, and they'd submit their application via fax to them. They're no longer doing that. Now you'd have to go specifically to the website, and you could go through va.gov and find loan guarantee, and you'd have to submit electronically through their site. Or I've listed their phone number, the 1-877-827-3702, and you can call them directly and work with them, so you could get a certificate of eligibility so you could utilize that benefit. But they are no longer accepting faxes, so we want to make sure that everybody understands that, because locally a lot of people like to try to fax and get their certificate faxed back to them as soon as possible, and that's not happening anymore. So that's some information on that. I also want to pass on the update that we had, and obviously, you know, we thank the Congresswoman on this as well, that they've addressed, or they've added three more conditions to exposure to herbicides dealing with Agent Orange. This is obviously for Vietnam veterans, or our Korean veterans that were along the DMZ, or Navy, Blue Water Navy veterans, or people that worked on the actual planes, the C-123s, that were exposed to the herbicides. And the three new conditions are bladder cancer, hypothyroidism, Parkinsonian, or Parkinson's-like type symptoms. So this all deals with the Vietnam veterans and anybody that can, and of course, anybody that can also say that we're exposed to Agent Orange, because we have had cases outside of Vietnam where Agent Orange has been proven to have existed in that area and was utilized by the military. And of course, the presumptive issue was granted for those individuals. So it's not just strictly with Vietnam veterans. I wanted to touch on the benefit dealing with spina bifida. We have a lot of individuals who have dependent children who may have gotten that type of birth defect. Now, this is strictly for Vietnam veterans, male or female, that were in the area. And again, we're talking about the exposure to Agent Orange, that spina bifida is recognized as a birth defect. And I want to make sure that everybody understands that if you feel that your children do have this birth defect, one, you have to make sure that the birth certificate legally lists the parents, specifically the parent that was in Vietnam, and you will utilize the VA form 21-034, and you'd submit that to our office. The child itself might be entitled to payments, healthcare, VRNE training, and so forth. So that's something of importance. We'd have other known birth defects, and I'm not going to get into all the aspect of it, but the other known birth defects are normally associated with the female veteran herself being in, or being the one that was exposed to the Agent Orange or the herbicide. And again, the child would have to have a birth certificate showing that the mother's the parent, and evidence showing how the condition that they're claiming is related to Agent Orange, and they would submit that on that same form, and hence VA would make a determination on that. That's kind of basically it on all the updates for VBA at this time. And I appreciate anybody that should have any questions at the end of the session. I'll try to answer them to the best of my ability. Outside of that, back to you, Carlos.
Thanks, Joe. And we actually did get a couple that were answered in the chat during these updates. And so I just wanted to read them out and then just have those answers read out as well, in case people aren't able to look at the chat if they're joining by phone. So the first one is asking if the Johnson & Johnson vaccine is available. And Blanca, I think you went ahead and answered that. And it was that there's currently a plan being worked on to receive the Johnson & Johnson vaccine. It's right now being intermittently used at various events. However, patients cannot request one of the other And so that actually leads to another question. Is it possible, if you are a veteran trying to get vaccinated at the VA, to choose which vaccine you receive, or is it just what's there?
So this is Blanca. I'll go ahead and answer that question so everybody can hear. So really it's, based on availability. As mentioned, we are working on a plan. So really the Johnson & Johnson, we can use at specialized events and really for targeted veterans that are in rural areas or when we want to reach more veterans because it is a single dose vaccine. So we're working through that plan and also looking at our community-based outpatient clinics that do service a lot of our rural veterans to see what we can do there. It is based on availability. There's not a lot of Johnson & Johnson vaccine. And so what I would tell you or tell veterans is if they have a true allergy to the ingredients in the mRNA vaccine, that they can talk to their provider about the feasibility of possibly receiving a Johnson & Johnson. And we can work through those on a case-by-case basis because really at this point, it's not, getting to choose which one or the other, but it would be based more on the medical recommendations as far as allergies to one or the other.
Great, thank you. And there were a couple of similar questions that were submitted, all of them having to do with having spouses become eligible for vaccination as well. And your update provided that as of today, veterans and their spouses are available or are eligible to become vaccinated. And I know you answered a question for Mr. Jimenez, but can you go ahead and just reiterate that walk-up vaccination event that's going on?
Yeah, absolutely. Happy to do that. So we need veteran spouses to register on the online link that was provided. That was provided in the chat. But again, if you missed that link or you want to find it, just go to www.va.gov. It's at the very top. And so make sure you register before the event because we need that information to create your record inside of our medical record system. So, register, go on today. It takes 24 hours turnaround. And so once you register, then on the 15th, we are having a walk-in event. So veterans and their spouses can walk in, no appointment needed, here at the main facility on April the 15th between 4 and 6 p.m. And we'll take care of both of you.
Great, thank you. And this question actually is for Dr. Glass. So someone pre-submitted a question asking, basically saying that the Johnson & Johnson vaccine, they've heard that it has less effectiveness than the other two. Can you go ahead and speak on that?
So far, there have not been any prospective studies to look at head-to-head efficacy of the vaccines. The Johnson & Johnson was tested on a little bit different population group, which included some of the new variants. In my opinion, because I get this question all the time from back home in Florida from my family, my parents are in their late 70s, and they've asked me the question, they say, which vaccine should I get? And my answer is very simple. Get the vaccine that you can get the soonest. I think that they all have very similar efficacy when it comes to safety, when it comes to prevention of COVID, when it comes to prevention of what I care about, which is hospitalization and death. So the short answer is, I think they're the same. And I would recommend that my family get the one that they can get the soonest. I would hate to see someone turn down a Johnson & Johnson vaccine to try to get a Moderna or a Pfizer months later, then they have that period of vulnerability. So I think that the Johnson & Johnson is very safe. If I had that one available for my kids today, if it was approved in kids, of course, none of them are, I would get my kids vaccinated with any of the vaccines that would be available. And I think that they all have very similar efficacy for the endpoints that I care about, which is hospitalization and death. So they're all very good at preventing hospitalization and death. So I think that if people think that one is better than the other, there's really no study that shows that. And I think that they're all very effective. Does that answer the question?
Yes, sir. Thank you. And so there was Ms. Guadalupe Chisholm also pre-submitted a question asking that her husband and herself are both covered under TRICARE for life, and they're asking to see if they can get vaccinated at William Beaumont, and if so, how? And so Colonel Shiki, I don't know if you're on.
Hi, I'm sorry, Colonel Oshiki had to roll out and go to another meeting. And so the answer is yes. And so as of the 19th, all DoD beneficiaries will be able to get the access to the shot. And there's two ways to go in to schedule appointments. And one is going on to tricareonline.com if you have an account to be able to do that. Or you can go through and go to our call center and if you dial 915-742-2273, and you can make an appointment through there.
And you said as of the 19th, and so that's of March or April?
Of April.
Of April, perfect.
Started today.
We're actually starting the vaccinations and such as of today, but according to the president, of course, on the 19th of April, making it available. And with as the Colonel had talked about earlier, with our bulk shipment we received in the last few days, we have that opportunity.
Perfect, thank you, sir. And this next question is for Joe. They're actually asking about VBA operational facilities, and they're asking if the VBA is going to be fully operational at the VA facility, and would like to know if and when that's going to occur.
Yes, we will be fully operational. We still have a full staff on board. Right now, they're all teleworking, and we're doing actually quite a bit of interviews either by phone or by virtual. VHA has also helped us out because many of the social workers are relaying the information on when veterans do come into the clinic looking for us, and they relay that information by email to me, and I make sure we reach out to everyone and anyone we can. Also, if we do get inquiries through the 1-800 number, they're reaching out to us out here, and they're also letting us know we're calling veterans also as well. I think the biggest problem that we're having with that is many times we are returning phone calls, and veterans or widows or dependents are not picking up. And sometimes I think they just see, since we're using the soft phone, which is an extension off of the VHA side, sometimes it's just coming across as either VHA or 6100 general number. I think sometimes they're not sure what it is, so they don't answer. But I would strongly recommend if you're familiar with the VHA line and you see that 6100 number, it's usually either VHA's calling or VBA's coming through a soft line that they gave us through an extension through the facility, and we're trying to reach out and help out somebody. Now, as far as the actual date of when we're returning to the main office, that's a judgment call that's made above my pay grade. All I can do is report what's going on locally, and the powers that be will decide when we will open the office. I had a meeting with them, or a conversation with them actually earlier today about that, and they said they still haven't gotten anything specific on when the El Paso office, the VB office, will open. We're projecting it's going to be soon because we've taken all the steps. We're finishing up with getting the last of our employees vaccinated. Some are going into the beginning of May, and then we should be almost there. So I think that's the first major step, is to make sure we have all the employees that want the vaccine to be vaccinated and that they feel safe. And then next, we want to make sure that all the parameters are taken to where we are allowing veterans in, and that they themselves and their dependents feel safe, that they're not just walking into an open area and feeling that they're being exposed, because it works on both sides of the coin. The safety has to exist for the employees, and it has to exist for our clients as well. But to answer the question, with the bottom line is yes, we're hoping in the near future. I can't give you a date. And two, it will be full staff like it was before. The offices will resemble the same. And VHA has always supported us with the space and whatever we need, and we continue to appreciate that support. And we will be ready once the word is given. I promise you, I will get the information out to everyone, and we'll announce that the VBA office is open and how we'll be seeing the clientele. What we're looking at is we're going to start off similar to the way all the other offices that have opened across the nation. We'll probably start off with a form of an app where you'll make appointments with us through the app, and you'll let us know when you arrive and the appointment time, and then you'll work your way into our area, and we'll see you by appointment basis. But at the beginning, we're going to start off that way to try to control the flow, because our office is not all that large, so we have to make sure that we still adhere to the current requirements that is required by the CDC and also the VHA side of the house, and that safety comes first. But that's the best answer I can give at this time.
Thank you, sir. And Dr. Glass, I see your hands up.
Yeah, I just had a couple of quick comments. I wanted to thank Mr. Joe Esparza for all the help from the VBA. Before COVID, I was primarily a compensation pension doctor. So I helped my fellow veterans get their ratings. I worked with the VBA directly to help people in that context. I've got about a half a dozen other providers that did similar duties. This past year, most of the business for compensation pension has gone outside of the VHA. It's gone to contractors out in town, civilians, to help hopefully expedite and improve the process. But myself and my other providers haven't forgotten how to do that. We have a lot of experience in comp pen, and I do take walk-ins every day. So after 1300, if there's a veteran in our facility and they have questions about compensation and pension, they're always welcome to come by and see me. I talk to people every day about those sort of issues, and so does my staff. So we're here, we're in person. I know that the VBA is not for safety reasons. We have and will continue to offer vaccines to the VBA. I know many of those folks have taken us up on the offer. So hopefully once they're fully vaccinated and their leadership gives the green light, they'll be back here in person. But we do have people here, myself included, that although I'm not an expert, I'm no lawyer, I'm just a doctor, I can definitely talk to people about the compensation pension process. I was a wounded warrior doctor when I was on active duty. So I helped injured sailors, Marines, soldiers, airmen, help them with the DOD side of the house. So I've been really in the comp pen business for over a decade now. So people are here already for another point, and they happen to have a question. We do have staff down on the second floor in special exams, myself included, who can answer, at least at a basic level, some of the questions people may have for the VBA. When it comes to actual filing claims, obviously we can't do that. The VBA, they're the experts on it. But sometimes people have simple questions, and we're always available to answer those questions if folks have questions about that. Anyway, that's all I've got.
Great. Thank you, Dr. Glass. And Blanca, I wanted to ask you here in the chat, there was a mention of the biweekly town hall for veterans and how those who are registered get an automatic robocall. But for those who are interested or are not registered, how do they participate in that? How do they get that call?
So you hit the nail on the head. It goes to our registered veterans. So if they're eligible for care and they want to receive those calls, they just need to register with us and provide a cell phone. So these are automatic calls that go to a phone or even a landline. And we do it we can call them. It's an automatic call, and it's every 2 weeks, always on Thursday. So they can just give us the call here. They can call the registration office, but then they would expect a call every first and third Thursday of the month. And they can call here, the registration office, if they have questions about registering, to be able to receive those calls. And that number is 564-6150.
Great, thank you. And there was also a question about the vaccination cards and privacy. I don't know, Dr. Glass, if you'd like to speak on that, about the vaccination cards and just how to where that information goes, or just how to keep it private. Should that information be shared?
So yeah, so we have CDC cards, which we give to all of the veterans and employees that get vaccinated through our facility. I tell to folks, when they have a CDC card, it's more of a physical proof that they've had the vaccine series either partially done or completed. The CDC cards, that data that we have, which includes the vaccine lot number and the type of vaccine, that's also inputted electronically. So we have a system called CPRS, which is the patient record system that we use for all of our veterans. That information is then forwarded to national to the CDC for tracking purposes. For employees, we have a different system called OHRS 2.0. And those are both secure systems where we keep electronic data about the vaccines we given. So total number of vaccines given, any kind of complications people may have had. The cards are really for the person, right? I've got my card in my wallet. I carry around with me. In case at some point proof of vaccination is required for getting on an airplane or getting on a cruise ship, those sort of things. Those things aren't required at this time, but certainly there's been discussion nationally about so-called vaccine passports. So I tell folks the CDC card is a physical proof that you've had that, and that data is not shared with other people other than the people that need to know higher up in the VA infrastructure and obviously the CDC. So the data that's on the CDC card is also inputted electronically but I don't make copies of the card itself. And the card is for each individual to keep on their person or in their glove box, wherever they want to maintain it. So if they're required to prove they've had the vaccine, they can produce that. I tell folks if they lose their card, I can go into our systems electronically. I can print out proof of the vaccinations if they need that. So if they lose the card, it's not something that we can't replace. We can always reproduce that data. It is captured electronically, but it's not shared with folks that don't need to know. Does that answer the question?
Yes, sir. Thank you. And Blanca, I just wanted to make sure. So people who are coming into these walk-in events, they have to pre-register online, correct?
That is correct. Yeah, and it's a very simple process. So they just need to go on that online link and register, and then it'll allow us to create the record. And so we want them to do that first before they call or walk in, so that we can avoid significant delays trying to do all of that in person. So, and that also, as Dr. Glass was mentioning, that also is a secure website, because they'll have to put their demographic and some personal information in there, but it is a secure link. Our notice of privacy practices are also on there. And then I would just remind the attendees on the CDC cards, just to protect your privacy, not to take pictures of them and post them on Facebook or social media, because that's where a lot of the privacy issues come, into play, is, people on the internet that are looking for that information, because of course your date of birth is on the CDC card. So if you're worried about identity theft or things like that, please avoid posting those. We will never share that information with anybody, other than in our record system. But please make sure you protect your own privacy by not posting that information.
And Dr. Glass, we also just got another question about the time separation between the vaccines, and what's the recommended time separation? And is there, I would also add, does the efficacy of the vaccine go down if it's slightly longer than the recommended time period?
So the recommendation for the Pfizer is 21 days, and for the Moderna, it's 28 days. So 3 weeks and 4 weeks respectively. And they've done studies up to 6 weeks out for both those vaccine series that show similar efficacy. So sometimes there's delays, and the vaccine still works up to 6 weeks later.
Perfect. So 3 weeks for Pfizer, 4 weeks for Moderna, and the Johnson & Johnson vaccine is just one dose.
Just one dose. That's correct.
Perfect. And sir, with William Beaumont will William Beaumont be putting on any similar walk-in events for vaccinations, or is it all going to be for registration only?
Yeah, unfortunately, no, not from a walk-in status. It is a 100% appointments for us. But we are opening those up again, like I said, with TRICARE Online. The call center, we beefed up personnel in the call center to be able to get the huge influx of calls that we've had. And so that's how we're doing it right now.
Perfect. Thank you. And then
Hey, Carlos, I do want to say something to piggyback off of what Dr. Glass brought up earlier about CMP exams. And we did have a change that I didn't bring up earlier that I do want everybody to know, but VBA has gone back to accepting disability benefits questionnaires from private doctors that veterans see out in the community. So, because we've had a little bit of questions about some of the CMPs being done by the contractors that are handling most of our exams now. So we've gone back and opened up the door and allowed for veterans to submit the DBQs, to disability benefits questionnaires, and have their private examiners fill them out, and it'll fill in just like a regular CMP exam. So we've gone back to accepting those because we had stopped doing that. So I wanted to make sure that everybody was aware of that as well.
that's a great update. Thank you. Thank you. And it looks like there's no more questions. We'll give it a minute just to see if any additional questions come in. A lot of the pre-submitted questions were actually answered by you, Blanca, about eligibility, just having everyone and their family being eligible to be vaccinated.
And I'll just add, if they do have questions about eligibility, am I eligible to get through the vaccine through the VA? That website that we're directing people to, it's very easy to follow and pretty, it's radio buttons. You can click on your eligibility and it will tell you right away if you're eligible to receive the vaccine through the VA. So please utilize all of the information out there. And then once you're registered, come see us on that walk-in event or, give us a 24 hours and call us and we'll get you scheduled for an appointment.
And speaking of eligibility, Dr. Glass and Blanca, what is the age limit to be eligible? What's the starting age limit?
So 18, so we're following the CDC recommendations, so 18 and all the way up. So a lot of our older veterans have been taken care of because that's what we started with. We targeted that older population due to the CDC recommendations. And so now it's open to everybody 18 and older.
And we had a question about popcorn at the walk-in event.
Oh yeah, we love pop. You can't eat popcorn and wear a mask though. That's the unfortunate thing. But we'll see what we can drum up. I won't promise popcorn, but we'll hopefully try to make those events fun.
Thank you. And again, we'll just give it another a minute to see if any more questions come in during this time. As we get near to the 1 hour mark at 10:30. And yeah, if anyone has any questions, please use the Q&A or the chat feature to submit them, please, at this time. So it looks like we don't have any more questions. I believe so. I just wanted to say thank you all for joining. Thank you to our VA leaders, William Beaumont, Joe with the VBA. I mean, you guys are an incredible team, and our veterans always, typically when we get casework, it's someone who has an issue, but what you don't hear is people who say thank you and are appreciative of just the work that you all do. And we can hear that, so I just wanted to pass that on. Again, thank you all for joining this morning, taking the time out of everyone's busy schedule for making this happen. And this video is being recorded. It will be put up on our YouTube channel for anyone who missed it, and we'll go ahead and share it out to help spread the word about these events and these updates that are coming out. So again, thank you all for joining. Dr. Glass, Joe, Colonel Shiki, but he's
Thank you for your time. Appreciate it.
and Miss Aragon. All right. Enjoy the rest of your morning. Thank you.
Thank you, Carlos.